What is the Medicare donut hole and how has it changed? Imagine facing a big bill just when you think your medication costs are under control. That's what the Medicare donut hole used to be for many seniors. It was a gap in coverage where you had to pay more for your prescriptions. Understanding this helps you plan your health care budget better. The donut hole was a phase in Medicare Part D, which covers prescription drugs. After paying your deductible, you entered the initial coverage stage. During this time, you paid 25% of your drug costs, and your plan covered the rest. Once your combined spending on covered drugs hit a certain amount, in 2020, for that was $5,030, you entered the donut hole. In this gap, you had to pay the full price for your medications. In the early years, that meant paying 100% of the costs, which could be very expensive. This made it hard for many seniors to keep taking their medicines. The good news is that changes started happening after the Affordable Care Act was passed in 2010. Over time, the costs during this gap decreased. By 2019, for brand-name drugs and 2024 generic drugs, the donut hole's worst phase was over. Now, during this period, you only paid 25% of your drug costs, just like in the initial coverage stage. Before 2025, Medicare had 4 phases. First was the deductible, where you paid a set amount before coverage started. Next was the initial coverage phase, where you paid 25% of drug costs. Then came the donut hole, where costs were higher. Finally, once your out-of-pocket expenses reached a yearly maximum, you entered catastrophic coverage. During this last phase, you paid very little for your medications. Starting January 1, 2025, the donut hole was completely eliminated. This change was part of the Inflation Reduction Act. Now, once your out-of-pocket expenses reach $2,000 in 2025, you automatically move into catastrophic coverage. From that point on, you pay nothing for covered drugs for the rest of the year. The out-of-pocket threshold will increase to $2,100 in 2026. This new system makes it easier to budget for prescriptions. Instead of facing unpredictable costs during the donut hole, you now have a clear cap of $2,000. Once you reach that, your medications are fully covered without extra payments. Medicare also introduced a plan that allows you to spread out your prescription costs evenly across the year. This helps you avoid large bills at certain times and makes managing your healthcare expenses simpler. Overall, these changes mean fewer surprises when it comes to paying for your medications. You can plan your healthcare budget more confidently, knowing that once you hit the out-of-pocket limit, your prescriptions are fully covered for the rest of the year. This shift aims to make medication costs more predictable and affordable, helping you stay on top of your health without financial stress.